A muscle contusion is essentially a really bad bruise of the muscle. It's the result of bleeding in the muscle fibers or between the tissue planes themselves. It is associated with a great degree of inflammation, and in hockey it can be the result of a direct blow either from equipment or a collision with another player. It's really important to address this particular problem right away because the bleeding and the ensuing spasm that can occur needs to be stopped. This can be achieved through bandaging or bracing of, in the case of the anterior thigh, bracing the knee joint in deep flexion to compress the muscle. As well, applying the normal protocol of rest, ice, compression, and elevation would be ideal, and avoiding anything that can stimulate further bleeding. This would include heat, ingestion of alcohol, massage, or ultrasound. Once the bleeding is controlled, it's really important for an athlete to seek the help of a physiotherapist to make sure that range of motion and strength is regained. It's also really important to consider padding, protective padding over the injured muscle, as re-injury rates can be quite high. And there's a potential for a very important long-term complication, that being myositis ossificans, which refers to a calcification of the site of bleeding in the muscle. This happens 3 to 4 months after the initial injury, so protective padding is particularly important. If you have further questions, please consult your primary care sports medicine physician.